listening to Chat with the Experts, brought to you by Angie's List on 93 WIBC.
Welcome back to Chat with the Experts, brought to you by Angie's List. We've had a healthy dose of advice today on preventative health care and stress management with the aid of Dr. Scott Renshaw of IU Health. It's been an extremely helpful health talk, but now it is time to turn our attention to our Writer's Block segment. And joining us today, once again, is Cynthia Wilson, a reporter with Angie's List who was on the show earlier this year to talk about health insurance while traveling. And her goal at Angie's List is to make sure that you understand the pros and cons of your decision and learn what medical services will cost before you accept them. She's spent a great deal of time also reporting on health care debt and researching consumer trends for investment portfolio managers. We're happy to have her back on the show today. Cynthia, welcome back to Chat with the Experts.
Thank you. I'm glad to be here.
You know, you've obviously done a lot of reporting on a variety of healthcare topics through the years. Do you feel that some of the information that you've learned through the years has been beneficial to both you and your family as you deal with health stuff?
Certainly. I always like to go into any type of situation, particularly, healthcare, knowing what I'm at least, being able to explain my symptoms to a doctor so that it can help me if that's the case. And then it's also just having an understanding or some pre-knowledge about what it is that I'm there for, because if I can ask an educated question, then I can get a better answer from the doctor. Yeah.
Well, today we're going to be talking about an article that you contributed to a recent package on cancer that Angie's List put together. I want to start off by asking why this package that we did on cancer, why was that such an important topic for Angie's List to cover?
Well, we all know someone who's probably had cancer. And the reality is that when you're dealing with cancer, you're dealing with so many other fights. It's just not the disease itself. You have financial, you have psychological, emotional, you have family matters, you have work-related things that you have to deal with. So when you're trying to fight cancer, it takes months. It's not, an in and out type of situation. And we wanted to give members and the consumers at large just more information, something consumer focused that could help them, deal with these issues.
Right. As a reporter, you get to hear a lot of different stories as, you write these articles. But this cancer package in particular, in my opinion, had so many just moving stories, incredible, photos to go along with it. Were you moved by some of the stories you were hearing as you were reporting on this?
Well, how can you not be? You're talking about people who are in a fight for their life, and you recognize, the humanity, their courage. Sometimes you don't really know what you're made of until you face a really, difficult situation. And I was really grateful for the people who talked with us and shared their stories, because in doing so, they help us help others. Yeah. And how can you feel bad about your day when you recognize that there are people who are dealing with so much more? Yeah.
Well, the first article we're going to discuss today is about handling the stress of cancer. And when you're choosing a doctor, their experience in the area is obviously huge, but what else should you be looking for?
Well, obviously, you do want a doctor who has some experience. And one of the things you should remember about oncologists is that their primary job is to get you into remission. So they're focused on the disease. But they, cancer doctors, oncologists now are also recognizing that because there's so much more that cancer does bring so much more to the table than just the disease itself, they're beginning to work in teams. And so you want a doctor who recognizes that these other issues that you're going to face are being addressed. Because if they are not addressed, then your willingness to even continue with the treatment may be jeopardized, and so therefore they can't even continue with their job. But you want to have a doctor who is going to be receptive to not just listening to you about your symptoms, but also helping you get the extra help that you need.
Yeah. So that's a huge part of it, and just the doctor understanding what help might be beneficial to you for your situation. And you talk about a few different options that apply to this conversation. The first being support groups. So what did you learn about some of the benefits of a support group?
Well, you're talking to people who have been there, so they understand, your fear, your fatigue, your anger, frustration. So the benefit is really there are no apologies. You don't have to apologize for how you feel because you're talking to people who understand, even maybe more so than you do, or will maybe can even anticipate what you're going to feel.
Yeah.
And so you have someone that you can go to and you can talk to. Support groups have kind of evolved in other ways too. With help of technology, you can actually, do online chats. You can participate in discussion boards. So you may want help, but you don't really feel comfortable being in a large group. So there are other outlets for you to be able to do this. And then also, if you're having difficulty traveling, maybe getting to a particular support group, these types of, technology can help you. And then sometimes you may be just able to have a discussion via phone.
Right.
And a lot of these support groups are operated by, licensed professionals. So, you kind of get the benefit of regular people as well as professionals who can help you cope with these things and steer you towards the resources that you need.
How important would you say it is to have contact with a mental health professional during this time?
My understanding is that it's crucial because, again, this is not just a disease. Your body's trying to fight a disease, but your mind is also involved in this. Your emotions, everything is involved, and you may not even recognize that you are having depressive symptoms, anxiety. So if you get, at least in the beginning, you want to get some type of an assessment of your mental state. And then as you're progressing through your treatment, you'll want to come back and do this. But the doctor wants to know, where is your head now?
Yeah.
What are some of the things that's going to affect you getting treatment and continuing with your treatment? And, if you have these assessments early on, again, you may not recognize something now, but you'll be able to say, oh, this is something that I should pay attention to, or maybe I should go back and get help because, when you're getting chemotherapy or, radiation, that can be painful.
Yeah.
And so if you've spoken to someone and they, you may want to go get some kind of medication to help you deal with that. So your doctor, these mental assessments can sort of kind of help you at different stages of fighting the disease.
Yeah, definitely. One thing that you talked about in the article was how a cancer research program can be of assistance during this time. When we talk about a cancer research program, what are we talking about there? What is this?
We're talking primarily, I think, about clinical trials. There are sometimes, again, you may, if you're going through chemotherapy and it's making you sick all the time, and so you may meet with a psychiatrist, and that psychiatrist may prescribe medication for you. But the medications that they're prescribing, aren't really helping you. So a clinical trial may be able to introduce you to a type of medical treatment, it could, or holistic treatment that can help you alleviate some of the symptoms that you're having. And, basically there's, new innovative methods that aren't quite available to the public.
Right.
So your doctor, you might want to talk to your doctor about that. They will normally be the person that have to see if you are qualified for it. But the good thing about the ACA, the Affordable Care Act, it says that for routine clinical trials, that insurers can help pay for that. But, it's also, you have to think about your policy. If you have what we call grandfathered policies that are after 2010, would do more than that. So, but you want to check with your insurance to see what you may be, eligible for, what, the insurer will pay for, what you have to pay for. And in many cases, the sponsor of the clinical trial can help pay for these things as well.
Quickly, as we wrap up here, I wanted to ask maybe what you learned, or what the best advice you discovered as you were reporting about, battling some of these mental stresses and psychological effects that come with cancer.
What works for you? There's no one way to address the stress and emotional turmoil that comes with getting a cancer diagnosis. So you want to get the help that you need. There's nothing, some of the professionals I talk to say some people feel like if they're asking for help, they feel weak. They may feel like they're giving up, and you're not doing that. You're trying to survive, and so you need to do what you need to do to survive.
Yeah. Cynthia, I want to thank you so much for sharing this information on a very hard topic. We really appreciate your insight. Thank you.
Thank you.
You can check out Cynthia's articles by going to angieslist.com, and from there you can also get reviews and information on service providers and health practitioners in your area. If you join today, use the promo code WIBC40. Another big thank you to Dr. Scott Renshaw of IU Health for sharing his advice. If you missed anything at all, you can catch up on our past episodes by visiting our website or downloading our Chat with the Experts podcast from iTunes. And remember, this is our last show at 9 a.m. starting next week, next Sunday, September 6th. The show will be airing at 8 a.m. right here on WIBC. Thank you so much for joining us today on Chat with the Experts. I'm Kyle Hawk, and we'll catch you next time.
More than 2 million members use the power of Angie's List to find and hire great local service providers. Whether you need a plumber or a pet sitter, Angie's List has you covered. See ratings and reviews in hundreds of categories, shop popular offers, and request scheduling assistance directly online. Memberships start at just $9.99 per year. That's less than $1 a month. Join now and get 40% off with promo code WIBC40. Visit angieslist.com today.